a little bit about me. I've been in the medical tourism since 2007. I started Mexico Bariatric Center in 2012, and I worked on a Hospital Azar project since 21, and we just opened our new hospital in 24. And uh, some updates, some news is we will be in Atlanta next week, Sunday, May 4th, 11 to 1 p.m., 11 a.m. to 1 p.m. in Hyatt Place, Atlanta, Buckhead. And we would love to have our past patients bring friends that are interested in getting surgery with us. And we would be there. Well, I myself go there on Saturday, but the webinar is on Sunday. And that's why one of the reasons we pushed this webinar to this week, so next week we can do the Atlanta seminar. And again, another news is I just met with Vanessa, our New Zealand coordinator, when I was down in Tijuana. She was bringing friends and family to get surgery with us from New Zealand. Some other updates, about a month ago, we did our 1000th surgery in Hospital Azar, and we were very happy to be able to serve people there. We just had the first set of endometriosis surgery done last week in Hospital Azar, very successful. And we're offering new procedures all the time. And the new procedure we're offering is SASI. Dr. Osuna is going to cover that shortly. And again, our webinars, we're trying to move it to the last Saturday of the month. Be sure to check our website. We always have new articles, informational articles about bariatric recipes, new procedures we offer, the informational and scientific research cases like endometriosis and obesity, for example, talking about different types of injection or weight loss medications, patients' testimonials. Again, make sure you check out because we have new stuff all the time. We try to cover as much as possible in our webinar slides. And if you don't hear the the questions you have during the webinar presentation, you can ask us at the end, but please make sure listen because a lot of the questions are common and we try to cover them. The topics that we're covering today is about obesity and its risks. We show you how to calculate your ideal weight. We talk about weight loss surgery, how it resets your metabolic system, and we compare it to medications like Ozempic type of medications. And we talk about why MBC, why go with Mexico Bariatric Center. We talk about our new hospital, how to schedule, what the packages include, and the support system that we have for patients before and after surgery. Dr. Osuna talked about different types of bariatric surgery or procedures that we offer, laparoscopic, endoscopic, revisional, reversal, all that she's going to cover. And then I will take over and talk about financing, medical tourism insurance, MTI. We talk about our nutritional program, support program, and we open up for Q&A. Again, please make sure you submit the poll that we have, and you see the link on the Q&A tab. At that time, we do the raffle for $2,000 off, and we'll see who's going to be the lucky winner today. Obesity, we all know what obesity is. It's affecting all the societies across the globe, including US and Canada and New Zealand, and basically um, defined in the medical clinical way. It's just called the BMI, body mass index. Body mass index is just the formula. You put in your height and weight and you get a number. Anything below 30 is considered okay. I mean, 25 and below is normal. And after that, you start going to the obesity zone. And we do offer services. And actually, Dr. Osuna is one of the surgeons that we have that make exception if your BMI is below 30 and for certain, 28 or 29 based on certain criteria. But we do have no limit of what we can do as far as BMI. We have done a BMI of 100 and 110 and 90 constantly in our center. This is a easy way to find out. Of course, the BMI is an indication, but if you want to find out what is your ideal weight or what would be your goal weight, you basically use the chart that you see here based on your height and your female male you frame size, of course. So if a lady is 5'4", 5 feet 4 inches with a medium size, supposed to weigh around 120. So if they weigh 220, they have 100 extra pounds to lose. Now, in the literature, they tell you, okay, gastric sleeve, you lose average of 70%, let's say. So, but again, these are just average, right? There is no limitation of what you can lose. I mean, we see people lose all their extra weight. But let's say if you're in average, you 70% you lose, so you will lose 70 pounds in 2 years, and your ideal weight would be 150. But again, there is no limit of how much you can lose. Again, the factors contributing to obesity: increased nutrient content of food, the sugary drinks, the ultra processed food, lack of physical activity. We all, confront that. So when we gain weight, not only the number of fat cells or adipose tissues increase, the change in structural composition. And as you see, there is the adipose tissue difference of a lean person and an obese person. The changes in the chemistry of our fat cells causes all the problems with insulin, which is diabetes type 2, not getting satisfaction from the food, satiety, we don't feel full, leptin, even our muscles don't respond to exercise and protein because of obesity. Is a major risk. 40% of Americans, adult Americans, are dealing with this problem, and is causing all sort of cardiovascular problems, immune problems, lung problems. During COVID, we found out that we need to lose weight and live a healthy life because the coronavirus, it attached itself to the fat cells, and the more fat cells we had, more chance of ending up in ICU and death and hospitalization. So the cure for obesity is, of course, diet and exercise. We always have to watch what we eat and be active and exercise. But for obesity is not a long-term, proven long-term solution. So then, throughout human history, we always looked at a magic pill to take to lose weight. And it's almost there. But, the injections, and then there is a new pill coming out. But again, you have to keep taking them. And we will see the drawbacks and pros and cons of it in a minute. At this point, still bariatrics, weight loss surgery is a quick, safe, and long-term solution for obesity. Is a gold standard. So when we talk about metabolic system or body's thermostat or brain thermostat, basically we're referring to the interaction of our hormones in our brain, and that determines or how our metabolic system is set. So if I weigh 250 pounds, my body is used, my brain body hormones are interacting, is used to that set point. And let's say if I do extreme diet and exercise, okay, when we're talking about exercise like a boot camp type of exercise, and my body is rejecting or is resisting against losing weight by increasing my hunger, decreasing my metabolism, and want to take me back to where I was at 250. But when I get bariatric surgery, the minute I wake up from the operation, the brain sees you at a lower weight, let's say at 175 pounds. Now, as a result of that, your hunger goes down and your metabolism goes up. So that's the difference between diet and exercise and bariatric surgery. Now, the new GLP-1 medications, right? So first, the scientists, the medical community thought that, hey, the reason people are losing weight is because there is restriction or malabsorption, yes, but as a result of this, your body's hormones are changing. And look at the list of the hormones that are changed due to the bariatric and metabolic procedures. It's not just GLP-1. There are so many of them. And what the pharmaceutical are doing is trying to simulate or emulate the effect of these hormones by giving you synthetic hormones like GLP-1 and like Mounjaro, which has two of these, which is GLP-1 and GIP. Of course, these are amazing drugs, but you still don't have the natural effect of what bariatric surgery does for you. And because of anatomical changes, you have restriction in your stomach, you have the intestinal changes, malabsorption, so is not the same. Yes, it's a great drug, but it's also, we don't know what the long-term effects of these are. It could be, so many different problems, and you have to keep taking them. Once you get off of it, you basically going to gain the weight and maybe even more. So that's the difference between bariatric surgery and injections or GLP-1 semaglutide medication. Now, we see a lot of our patients coming in, and we hear that they say, yeah, I've been on Ozempic or Wegovy or Mounjaro, and I got tired of it. Also, it's cost prohibitive because you have to pay every month, and after 6 or 12 months, now you lost weight, but you still have to keep taking it. And then again, we don't know what the long-term effects of these drugs are. So this is a pyramid that I like because it shows what diet and exercise works for a small portion of population. And then it comes injection, then endoscopic procedures like gastric balloon and endosleeve ESG. And the gold standard, like I said, is a sleeve bypass, mini bypass, SASI, SADI, and DS, duodenal switch. So we are like a last resort. Medical tourism is a way to go somewhere else to get a procedure that is either cost prohibitive where you are, or you're not capable of getting it at the city or location that you are. We come into picture because we arrange everything for you, from the transportation, hotel reservation, all the maneuvers that you have to do down there. And we have basically standardized or put a kind of a regulation on what happens with the surgery, what happens with the hospital. Even if you look at CDC, they suggest or they recommend that you go with a coordination company like us. So MBC is, again, like I said, I started in medical tourism in 2007. Actually, I met Dr. Osuna around 2010, and we started working together. And basically, we have a long history in the business. We are a US corporation. And we, like I said, we are in a way regulating what bariatric surgery in Mexico is supposed to be. And everyone is following us. So with 13 years in business, with of course MBC alone, we have done, as of January of this year, 27,000 successful surgeries. And we work with top-notch 5 team of surgical teams that one of them is Dr. Osuna. And you ask why MBC? So many reasons, and I'm going to show you later bulleted point that why the reason you need to select us. Our reviews, of course, our patient videos all over the place that organically, we're not like just social media, Instagram with some influencers that promote us. We are deep. I mean, the company has layers and layers. Our algorithms, the systems that we use, we do so many things the right way. For example, we manage the surgeon's load on a day-to-day basis. And our surgeons are not like they started yesterday. Again, look, Dr. Osuna, she's actually half-time in Guadalajara because that's where she lives, and she comes to Tijuana half-time. She's one of the, top medical clinical surgeons, clinical practitioner that works in high-end hospitals in Guadalajara. She is been doing this for, gosh, I don't know, so many years. We don't have these assistant surgeons that just take off and they start their own Instagram and business and they want to take you and just do very simple. That's all they can do is simple procedures. Again, I always compare the surgeon's experience with the pilots because you're giving your life to these people, so you need to be careful who you go with. Most of the time, the experience of the pilots don't come into picture, but it comes into picture one time, and you need that experienced pilot who has been doing this for 10, 15 years. One mistake can cause our life. Now, another thing that is, these are like hidden points, right? We don't look at it. We just look at the Google, what before after pictures of, but not only the surgeon is important, their team is as important. The surgical team is helping the surgeon to not only do a good job in each surgery, but it enables them to do complicated stuff. And we have these 5 teams that are independent. They're all staffed on their own. It's not like we just have 5 pictures of surgeons and they just work together. No, these these are all independently working and working together, but independent of each other. And again, we're not a company that we just post some cute TikTok videos. I mean, a lot of people basically, I mean, the landscape of things have changed, right? We're not like 10 years ago when only organic or pay-per-click was a factor and people just look at your website, right? So you may want to dig deep, not only look at their Instagram and TikTok and Facebook, just look at how many years they've been doing this. Who's behind the company? Are they just, I tell you, there's so many companies right now that they want to imitate NBC and they want to be NBC. We call them wannabe NBC companies. They try to imitate what we do, but underneath they don't have what we have. And that's why they keep forming new companies and they can't do what we do and then they go away. We've been around, we'll be around. You come back, you can call us again and ask for support, whether it's nutrition, whether it's paperwork. So, and then like I said, you don't know what, I'm like the face of the company, right? They know me. I go down there in Mexico, in Tijuana, and they're all like, oh yeah, we know you. So this is basically our new hospital, Hospital Azar. I named the hospital after my mom. I lost her to cancer last year. And again, this center is one of the most advanced centers in Tijuana right now with all the equipment and state-of-the-art sterilization, operating rooms. It has 4 operating rooms. We have about 39 beds. We're working on the spa area. We have great views. They have great experience. The patients we try to take care of, and they are happy. Again, so um, during COVID, we couldn't have the companion stay with the patients, but now we open that up so the patients can bring companions with them, or they can stay in Hyatt. We have extended our visiting times from 7 a.m. to 7 p.m. Of course, the companions only have access to a recliner chair. So it's really up to you where you want your companion to be. Our process is very simple. We don't give you a runaround. You fill out the health questionnaire. Like I told you, go to MBC, MexicoBariatricCenter.com. There's a link right there. You fill out the health questionnaire. Do as much as information please put in there. Be complete. Our surgeons review that, and you will see our approval process. And we would give you within a day or two, maybe 2 days maximum, you will hear from us about your approval. You can actually at that time pay the deposit, and book yourself online. So, or you can go through our coordinators and do that. Once you are on the calendar, you pick a date, you know all that detail. You have to arrange for your travel, whether you are flying in or you're driving in. You let us know your flight number, all that information go to your file. You complete your paperwork, your consent form, all that. We want you to bring a passport, and you're on your way. So these are all-inclusive packages that we offer. Again, as you see, the surgeon fee, the hotel night, hospital night, everything is included in the package, and we don't do this like an outpatient basis. We keep you enough time in the hospital to make sure you're doing well before we release you. Now, if you have a conflict in your flight coming in and going out, which we actually asked you to come in, I had it here, but it will be a few more slides. So we want you to come before noon and depart around 2 p.m. That gives us enough time to do the pre-op when you arrive and take you across the border. We also use medical pass, but again, we have no control over things. We try to do our best, but to be safe, we want you to depart around 1 or 2 p.m. Now, again, we talked about why MBC. One of the reasons we, so successful is our support groups and support before and after surgery. Facebook support group is a huge part. This is a main group that is only for our patients. I see a lot of companies, they have a bigger groups, but that's not for patients only. Everybody is there. So we keep your privacy. And we also have another one, which we call Inside Facebook Group for MBC, which are for people who are submitting the health questionnaire. They still don't know if they want to do the surgery or they're on the fence. So again, the support that we give is not just one way or the other. We have surgeons Q&A every Wednesday, and from 10 to 10:30, one of our surgeons in the Hospital Azar goes live on Facebook. You can get on and ask questions. Like when I was there, Dr. Osuna was the one on last Wednesday. And again, our coordinators go live. Those are Thursday, 3 to 3:30 Pacific time. Again, these are all Pacific time. Look at the support you're getting. These are just our affiliate, not our coordination. They are helping with coordination, but we have 6 of our past patients that work us day in, day out to support you. Sarita, Rena, these 2 are from Georgia. They're going to join me next week in our seminar in Atlanta. And Jamie, Kelly, Laura, and Vanessa that I mentioned, she's our New Zealand patient coordinator. Actually, Sarita and Rena do a podcast. I recommend you watch that. For people who joined later on, and we had some kind of a rough start today, I'm sorry for that. Go ahead and do a health questionnaire on MexicoBariatricCenter.com. Again, this raffle is only for Dr. Osuna, okay? For all the type of surgeries that she offers. Again, the Zoom pool I released. Please make sure you do that. Another success that we have. We combine the expertise of these 5 team of independent surgeons. And these are exclusive network of surgeons that we work with. Dr. Montalvo, Alejandro Gutierrez, Rodriguez, Dr. Osuna, and Ceja. And again, the way we do this is we have developed complex algorithms. So when you first submit your health questionnaire with the intelligence that we have put in the system, would select the best surgeon for you. Of course, some people have preference, but that's okay. We still try to get you to that surgeon. A surgeon liaison, she is a doctor that actually, American doctor that studied in the Guadalajara Medical School. She's sitting in between every HQ that goes between patient and the surgeon. And of course, our patient coordinators are always around if we need something, and our nutritionist, which is on our staff here in our office in Sacramento, and that's actually where I am doing this. We use Hyatt most of the time. Again, Hyatt is the highest demand hotel in Mexico, and that's why please make sure that try not to reschedule or cancel last minute, because we work very hard to get these rooms for you guys reserved. Like next week, even for myself, if I I go next week, they want $300 for every night. So that's how the rates are in Hyatt. So we cannot do last minute changes. We do this a month ahead, and they gave us a certain quota, and we have to make sure you guys are accommodated. So it's very important to make sure you pay attention where you want to stay, whether you want to stay in hotel or stay in Hospital Azar the night of your arrival, and not change. It's very, very important to work with us because we're trying to accommodate you the best possible, have the best experience, seamless experience. So we need your cooperation to be able to serve you the best, okay? Our pre-op diet is very simple. It's based on your BMI. And it starts from 2-day clear liquid and it goes up. Again, it's very important to do a good job on pre-op diet because that helps you with the recovery, helps you with the surgery, helps the surgeon with the surgery. And no matter what BMI you are, the better you do on the pre-op, it helps you a lot. Okay, so as a general rule, don't take any blood thinner or NSAIDs 1 week at least before surgery. Stop smoking at least 30 days before and after. I know some people have a hard time. This is very important to comply with these. If you're on Ozempic, any type of GLP-1 medication, at least stop 3 weeks before that. We see a lot of patients coming to us now that were on Ozempic. Again, the doctor and the surgeon liaison is going to instruct you what to stop, what to start. And if you're taking a medication on a regular basis, please bring the bottle with you. Again, we want you to arrive before noon and depart after 2 p.m. But I guess don't do too much too far out after 2 p.m. because then you'll be waiting too long at the airport. Now, if you have conflict in your arrival or departure, the options are Hampton Inn or Hilton or Sheraton by the airport. Hampton Inn has a special rate for us, for our patients, if you mention your name. but the other ones are more expensive sometimes. Um, you can stay before, like come a day before your normal arrival and just stay there and enjoy the San Diego area. You know, it's beautiful around the marina and all that airport there. So they are renovating Terminal 1, which was Southwest. If you're coming with Delta, United, all those will be Terminal 2. But Terminal 1 is kind of a mess. But anyway, no matter what, our drivers are there waiting for you. They call you the day before your departure, and you would connect with them. When you get your please pack light, you don't have to bring a lot of things. Uh, because Tijuana is right next to San Diego, so it's not like extreme weathers. We don't have like snow or like hot weather, like a desert. So bring light suitcase. Don't pack too much, and you get your baggage, and you walk out of the terminal. You see on the sidewalk is all um, designated by letters, A through whatever. So you tell the driver, hey, I'm on letter F, come pick me up. They show up and they take you to your pre-op test and all that. So then you can either you stay in pre-op in Hospital Azar or hotel. You basically relax. We give you broth, jello, all that stuff. On the day of surgery, they either bring you from Hyatt or you're already in the hospital. They take you, they prepare you for surgery. You stay there enough time to recover, and we do multiple leak tests. We do all the right things, and you're ready to go back home. Again, if you have conflict, you can stay one extra night in either Tijuana side or um, US side. But again, if you stay in Tijuana, just tell your coordinator we arrange for your hotels. Your post-op diet is very also important. You need to go from liquid to solid in 4 weeks. Again, these instructions will all be sent to you. You have a chance to jump on a webinar with our nutritionist. You can call us, text us, and we get you all squared away. Again, these are the people you can reach if you have any questions. Um, um, so we talked about why NBC. It's like the experience and skill of surgeons are very important of what the complication is and how low of the complication and what the success rate is, right? So when we talk about our surgeons and we say these are experienced surgeons because we get better results than what is published. If you look at the survey we did for gastric sleeve bypass, mini bypass, and duodenal switch, you see the amount of extra weight that they have lost. In 2 years, we don't have the 2 years. Usually you lose weight until the first 2 years. Even after 1.5, which is 18 months, you're still losing weight. Look at sleeve, 74% average. Bypass, 80. Mini bypass, 81%. Duodenal switch, 86%. And these are, again, 1.5 year out. These are real data. Look at, I mean, we're showing the same results in a different way. As you see, DS, of course, has a better result, SATI or BPD DS. Of course, people worry about, oh, DS is too invasive, but if you really have obesity problem, super obesity problem, you may want to look into SATI and DS, and I'm gonna let Dr. Susuna talk about SASI, which is our new procedure. These are really good long-term, like 10, 15 years out. Less than 5% of our patients require revision. Again, in US, 15% of bariatric patients get revision surgeries. And the reasons that our patients get bariatric surgery, revision is insufficient weight, 74%, 14% of them have some kind of complication. Let's say they get reflux or some kind of problem like that. And the 12% is a combination of insufficient weight and complications. Okay, so I talked almost one hour. Dr. Osuna, hello and welcome. And well, I kind of gave you some introduction. She's been doing this for years. And here's the thing, our surgeons are so young and they have so much experience behind them. I work with her in Guadalajara, Puerto Vallarta, but right now we only work with her in Guadalajara. She is board certified surgeon, of course. She's worked in bariatric surgery since 2007, and she's capable of doing a lot of difficult surgeries, revisional surgeries. She's going to take over now and speak about all different procedures we have. And she's the one that's going to talk about SASI, which is our new procedure. And we're very excited to offer that. And she's going to tell you all the pros and cons of that. So please take over and let us know what procedures do you offer and each procedure. Thank you.
Hello, everybody. For me, it's a pleasure to be here. Like Ron said, I'm a bariatric surgeon, and I have experience of 18 years doing the bariatric surgery. Okay, the procedures that I perform is all types of the bariatric procedures, gastric banding, gastric sleeve surgery, mini gastric bypass, single incision gastric sleeve, R&Y gastric bypass, mini gastric bypass, DS, single anastomosis, duodenal switch, that is the SADIS procedure, revisional surgery, and reversal surgery if is needed. Normally, we don't need to reversals. It's a very low percentage, but if it's needed, I could do it. The other procedure that I am to talk about is the SASIS procedure. The SASIS procedure is relative new procedure, but it's a combination of two very known procedure. It's a combination of the gastric sleeve and the benefits of the mini gastric bypass too. The name of the procedure is single anastomosis sleeve ileal bypass. That is the name. That is the name of the procedure. Single anastomosis sleeve ileal bypass. It means that we perform a gastric sleeve and combine with anastomosis of the sleeve stomach and the connection for the ileum. The ileum is the last part of the small bowel. That's why we have a very high benefits with that procedure. SASIS It's a new procedure that I explained you before that combines gastric sleeve and mini bypass benefits. Reducing the nutritional risk, it preserves natural digestion, lowering deficiency risk beyond restriction. SASI harnesses hormonal shifts, the decrease to the ghrelin, that is the hunger hormone, and the GLP-1 and GIP. And have a lot of benefits, and the cons are not too much. The expectation is that the patient lose between 65 to 75% of a sex weight in the first year, and high percentage of duodenal switch. Patients with type 2 diabetes are cured or reverse of the diabetes, and less complex than SADIS procedures. The pros of the SASIS procedure is up to 75 excess of weight loss in the first year. It's less coded and stable procedure, less risk of leaks, acid reflux, and nutrition deficiencies. We can be reversed to a gastric sleeve and to mini bypass and Aaron White too. I think this is the procedure that is easily to reverse. Usually we don't need a reverse, but if we are talking about that, is the easily procedure to reverse. The cons of that procedure is a relative new procedure, but like I talked before, like I said, is a combination of two very known procedures, that is the gastric sleeve and the mini bypass. The lifelong bariatric vitamins and mineral supplementation, even though you have a risk of a deficiency of some vitamins and minerals, this is lower risk than SADIS because we preserve the pylorus. The pylorus is about between the stomach and the small bowel, and we preserve that and decrease the risk of the dumping syndrome. That specific technique in that procedure reduce the risk of dumping syndrome that is frequently in the Aaron White bypass. If we preserve that valve, we prevent that situation. And the other thing that is less risk of the deficiency of vitamins and minerals is because the half of the meal that you intake goes through all the digestive tract. That's why you are going to absorb some vitamins and minerals, and others are not absorbed. That's why we're talking about less risk of deficiency in vitamins and minerals. The median time of the procedure, it's less than in the picture. Is 2 hours, 2.5 hours. It depends obviously of each patient. And we can see the hospital nights, 3 nights, and the recovery, it's 3 to 6 weeks. It's very similar to the recovery of the gastric bypass, but we have the benefits that I am talking to you. Okay. This is the gastric sleeve surgery, like you know about the procedure. In this, we remove the 80 to 85% of your stomach. is when it could be single incision or it could be a normal approach that is with 5 tiny incisions. And we always use a boogie to calibrate the gastric sleeve to prevent restrictions. And we use a boogie, normally 34 French, to calibrate. In this procedure is a restricted procedure. You are going to lose weight because your intakes are going to be less, because you are going to have the 20% of your stomach. And these procedures lowers the hunger hormone, that is the ghrelin. And that's why you are going to have less hunger than usually. And the expectations is to decrease the levels of ghrelin, that is hunger hormone, increase levels of GLP, increase levels of PAA, and no change in GIP. The pros of the gastric sleeve surgery is can be easily revised. We normally advise the best procedure of each patient and try to be the final procedure, but some patients needs a revision, and it's a very low percentage, but some patients need it. And the gastric sleeve is easily revisited if the patients regain, or if the patients want to lose more weight, or if the patients develop acid reflux, could be easily revisited. A high amount of excessive weight loss comparable to the gastric bypass, resolutions of comorbidities, no change to anatomy. We cut vertical the stomach. That's why your digestion is going to be the same before and after the gastric sleeve, and the recovery time is shorter. The cons is can worsen pre-existing acid reflux or GERD, and it is not reversible. Okay, in the patients that previously have the GERD, we prefer to advise the RNY gastric bypass. But if the patient has lower acid reflux, we could review and maybe could perform the gastric sleeve and review that if the patient have a hiatal hernia, and we repair the hiatal hernia to prevent the acid reflux too. Okay. The single incision gastric sleeve is the same procedure of gastric sleeve. The only difference is the approach and the incisions. Single incision, 1 incision. Normal approach, 5 tiny incisions. And inside, the surgery is the same. The expectation, the pros and the cons are similar, only not all patients are candidate for the single incision. It has to be 40 or less of BMI. The endoscopic gastric sleeve surgery is a smaller stomach is formed by holding the stomach to create a banana-shaped tube, and this is done by endoscopy. The expectation is hold less food and decrease food intake, lower amount of excess weight loss, not well suited for patients with gastrointestinal bleeding, a large hiatal hernia, or previous abdominal surgery. The pros of this procedure is that it could be reversible, reduce complication rate because it's endoscopic, and not incisions or removing tissue, and shorter recovery time than others. And the cons, potential risk of opening of the stomach pouch, and the risk of ulcers. That's why it's not indicated in patients with background of previous ulcers. The duration time is less, is around 30 minutes, one hospital night, and the recovery is less than in other procedures, 1 to 3 weeks. Okay, the RNY gastric bypass. This surgery forms a new stomach, that is the pouch, while the remaining stomach stays in place. And the small intestine are rerouted to bypass food digestion, which creates malabsorption and reduce calorie intake. Okay, the expectations of the RNY bypass is only a slight decrease in the ghrelin because we don't take off that part of the stomach that produces. Increased levels of the GLP, increased levels of the PYY, GIP decrease, especially in diabetic patients. And this is the gold standard procedure in the bariatric surgery, higher amount of excessive weight loss. Improves obesity-related comorbidities like diabetes, high blood pressure, sleep apnea, and others. And the cons is that chance of vomiting and dumping syndrome is not too high, but could happen after the gastric bypass, and the higher risk of ulcers. And the surgery takes 1 hour and a half, 2 hours, and the hospital night are 3, and the recovery time is around 3 to 4 weeks. Okay. Some patients always have that question, that important question: what is the best surgery, bariatric surgery to me? I always say that all patient is a specific case. Maybe a patient have some characteristics that it's preferred to some procedures, but I always analyze the specific case. For example, if we have a patient with BMI of 30 and with abdominal scar tissue, previous ulcer, and doesn't want to alter the anatomy, the gastric sleeve could be the best. But we have to make a very good evaluation to be ensured that it's the best. For example, in a patient with BMI to 35 to 55, with acid reflux or GERD, slower metabolisms, sweet tooth, and have a lot of chronic diseases, maybe the best procedure for you is going to be the gastric bypass. But all patients have to be evaluated, but every case is important to me for this to decide the best procedure for the patient. Okay, the mini gastric bypass, the only difference about a mini gastric bypass and the RNY bypass is that mini bypass is one anastomosis bypass. It's creating a pouch that is bigger. The pouch is bigger than in the RNY bypass, and it's a connection of the intestine to that pouch. It's only one connection. And the expectation is reduce the feeling of hunger through the altered gut, earlier satiety or feeling full after small portions, reduce calories and nutrients absorbed, and resolve or treat diabetes and type 2 and other chronic diseases too. The pros of this procedure is that it's only one connection. Safe, effective, and shorter procedure than standard RNY, and one of the most effective surgeries that revise after that sleep is failed, for example. And the cons is chance of vomiting and dumping syndrome, high risk of ulcers, and it could be the bile reflux. The medium time of the surgery is 1.5 hours, 2 hours, and the hospital nights are 3, and recovery is 2 to 4 weeks. Okay, if you have the question, I am interested in a malabsorptive procedure that is the gastric bypass or the mini bypass. What is the best surgery? Okay, the BMI is similar. If you have a marginal ulceration, it's better the gastric bypass. If you have acid reflux or GER, is better the gastric bypass. In the gastric bypass, it's more weight loss in the R&Y, and both are very good for chronic diseases, but the gold standard is still the R&Y gastric bypass. Okay, the duodenal switch surgery is also known like biliopancreatic diversion with a duodenal switch. It's a powerful weight loss and metabolic surgery. It's created like gastric sleeve, and after it's made a connection to the ileum, that is the distal part of the small bowel, to the duodenum. The duodenum is the first part of the small bowel, and that's the extra thing different to the bypass, that we preserve the pylorus too. Okay, that prevents the dumping syndrome. The expectation in the DS is that the patient lose 60 to 80% of the excess weight in the first year. A high percentage of DS patients with type 2 diabetes are cured after surgery or treated. Malnutrition is a problem with the DS, and vitamin is a must after the surgery. But if the patient follow the medical nutrition instructions, and it couldn't happen if the patient take the vitamins and follow the instructions. The pros add up of 80% of excess weight loss in the first year. The stomach size is reduced, like I said before, is a combination of a sleeve and a malabsorptive procedure. Highest metabolic effect, highest expected weight loss. And the cons, extremely strict vitamins required for life, and higher risk than other bariatric procedure. The duration of the surgery is takes to 3 to 4 hours. Hospital nights are 3, and recovery is around 6 weeks. Okay, this comparison is similar to the gastric bypass and mini bypass. This is a DS and this is the SADIS. The difference is that the SADIS is one anastomosis, one connection to the duodenum to the ileum, and the DS has 2 connections to the duodenum to the ileum, and the bowel to the bowel. The BMI is the same. The indication for the BMI is the same. In the DS, body absorbs fewer nutrients or calories. Dumping syndrome is if one it's purely only in that patients. Helps relieve sleep apnea, and average weight loss in 2 years is 45%. In the studies is almost the same. Only the average excess weight loss is in 2 years is 35%, but have the lower risk of leaks because we only have one anastomosis instead of two. Okay, revision surgery is not frequently, like Ron talked about you before. It's less than a 5% in Mexico Bariatric Center. We always try to advise the best surgery for avoid a revisional surgery, but some patients require because they stop losing weight, they regain weight, or maybe they have one issue with the previous surgery. For example, they could develop acid reflux, and we want to treat that issue. It's talking about repairing, revising, and moving to another bariatric surgery, about revisional surgery. The lab band could have a revision to a gastric sleeve, RNY gastric bypass, or mini bypass too. The gastric sleeve could be reviewed to a RES sleeve. Not all patients that candidates to a RES sleeve, but could happen, and could revision to the gastric sleeve to a RNY, mini bypass, or DS2. And gastric bypass could be revised to the revisional bypass, to a endoscopic procedure, or to a duodenal switch. And we also do revisions from the gastric balloon, endoscopic sleeve, vertical banded gastroplasty, and the reversals, like we said before. And the expectations after revision surgery is lose weight that was regained after previous surgery, switch to surgery that is more effective and better for the patient, and resolve issues from the previous surgery. The pros: continue losing weight again, relieve complications from previous surgery like acid reflux, and weight loss may be more effective. And the cons is the risk of complications, because before we begin the surgery like itself, we have to take off all the scar tissue of the previous surgery, and the recovery is a little longer. And the duration, it's variable. It depends of the procedure, the first procedure and the revisional procedure, but the median time is 1.5 hours and 2 to 4 hours. The hospital nights could be 2 to 3 nights, and the recovery is 4 weeks, around 4 weeks. We offer 20 techniques bariatric revision and reversal surgery options. We have here all the procedures that could go to revision. For example, gastric sleeve revisions, sleeve, bypass, DS, SASIS, endoscopic sleeve. The gastric band revisions could go to the gastric sleeve, bypass, DS, one anastomosis or SATIS, and SASIS. Endoscopic sleeve could go to the gastric sleeve, bypass, and SASIS too. The gastric bypass revision, could revision to a bypass. What does mean the revision of the bypass to the bypass? We review the previous surgery, review the pouch. If the pouch is increased, could reduce the pouch, and we review the length of the limbs. If the length of the limbs is too short, we distalize the bypass, and we give more malabsorption to the patient. The gastric bypass could review to the TOR, that is that endoscopic revision, and to a duodenal switch. Vertical banded gastroplasty revisions could go to the gastric sleeve and to the bypass or mini bypass too. And the gastric balloon revisions could be revised to a gastric sleeve, a bypass, mini or complete, and DS, the same, DS, complete, or SADIS, and SASIS too. Duodenal switch revision, revision, or gastric bypass, and the applications could have a revision to a gastric sleeve, bypass or mini bypass, and we could have the reversal options. The reversal options in the gastric bypass. In gastric sleeve is not common because we have to review the gastric sleeve and the reversal of the duodenal switch. In reversal options, it's to the SASIS procedure. I think the SASIS procedure has the easily procedure to reverse than others, because we could do reverse to the gastric sleeve only. Obviously, the bariatric surgery helps for a lot of chronic diseases, especially metabolic diseases, like the polycystic ovary syndrome. It helps to lose weight, and the lose weight and hormonal procedure helps to the polycystic ovary syndrome. That it's going to have an effect in the fertility of patients. That's why those women patients that are thinking about have pregnant and they can't, and they have polycystic ovary syndrome, it's better to go first to a bariatric surgery and after try to get pregnant, because it's going to be easily, because the metabolic surgery helps to the polycystic ovary syndrome. Okay. For return to work, it's so quickly because all our surgeries are laparoscopic. The laparoscopic benefits is that patient has less pain, the recovery is easily, and return to work is earlier. It depends of each patient, it depends of each procedure, but the medium time it's gonna be related with the procedure. For example, gastric, you can see in the presentation that the gastric sleeve, it's less time of recovery, and the bypass, duodenal switch, and the SASIS, it's the similar to recovery, but it's around 3 weeks. But if you have a job, like office job, it could be 1 week. It depends of each patient, it depends of each procedure, but the recovery is too fast.
Okay, thank you so much for taking time and explaining all that. Just wanted to go over more procedures that we offer, of course, through Mexico Cosmetic Center. You can go to mexicocosmeticcenter.com. Again, the same way you submit your health questionnaire, but this way you put your pictures also, whether you want face or body recontouring. We do a lot of mommy makeover. Remember that as a post-bariatric patient, you need to have a surgeon, not only is plastic certified, is also have experience with, is like a reconstructive surgery, basically, and you do need a surgeon that has experience with post-bariatric patients. I mean, we do a really good job on facelift, deep tissue facelift. My makeover could be tummy tuck, um, breast lift, or arm lift. We try not to do too many, not try, we don't do too many surgeries, procedures in one operation for your safety. We do have a limitation of how many hours you have, we, we have you down on anesthesia because it's very important. It's taking very risk when you go over 6, 7, 8 hours. Not only is not good for you, is also the surgeon starts getting tired, they make mistakes. Again, these are the other factors that we look at. We work with surgeons that are skilled. We monitor them. The same thing I said, we regulate business basically in the cosmetic center too. One thing I wanted to mention is even for bariatrics, especially if you're coming for revision, please do a blood test, which your hemoglobin needs to be on a high end. We're talking about at least 12, 13, 14. And if you don't have high hemoglobin, please take care of it before you come. I mean, we can do it when you go down there, but it's better if you take care of it at home before you come. Like I said, we offer other services. We start doing endometriosis. This is a stressful disease that it's very hard to diagnose, and it's hurting a lot of women as far as fertility and whatever pain. We do hysterectomy. We do a lot of different procedures now to help. Also, as far as payment, we take Zelle. Most of the patients pay the deposit with credit card or Zelle, and then they bring a cash or check. But we want to make sure your payment is accounted for 15 days before. So even if you bring in cash or check, please send the picture to your coordinator so we can put it on your file. Again, help us make your experience seamless by doing the paperwork on time, making your payments on time. If you have to get financing, I know it's getting harder to get financing, but you can, there are so many different ways. Best way, maybe your 401k, the bank relationship, if you have credit union, Super Money is the one link we have on our website. You can use other resources like SoFi, and just make sure you don't apply to too many places at one time because it would hurt your credit score. Why NBC? We offer medical tourism insurance at a fraction of what you could get it if you were not signed up with us. For $99, you can get complication. You can see the benefits that gives you. We really have worked very hard to reduce the price of this MTI insurance to so low. This is about $450 value, but we are offering it you to $99. Of course, there is a company that offers this. It's not us. We basically connect you with them and you get the coverage. Natalie, our nutritionist, is here in our office 8 to 5 Pacific time again. We do have a lot of nutritional plans that can help you. One of them is Emerge Bariatric Vitamins. I want to emphasize again, please make sure you take the bariatric vitamin after surgery. For sleeve, at least the first 2 years, bypass 5 or more, DS lifetime. These multivitamins give you what your body needs post-surgery for bariatrics. And some come with iron. They're different, like a chewable, drinkable, soft chew, different kinds. Try it out. We do have samples in our display in Hospital Azar, but we have not been able to actually let you take it with you. We're working on that. But for now, just go on emergebariatrics.com and you can order it. And you see different packages. Okay, so we get finally to our Q&A session. I see 6 open, which is good because sometimes we have over 100. So they're asking Dr. Osuna that if they go to surgery, by the way, Dr. Osuna, you are on mute. They're asking if you, just a moment. So this is not the video.
Got it. I'm going.
Okay, so Dr. Osuna, they're asking about hiatal hernia repair during surgery. So please explain what you guys do. Look for hiatal hernia, and if it needs to be fixed, you fix it. So please explain that.
Okay, the hiatal hernia, it's very common in obesity patients because one of the causes of the hiatal hernia is the high pressure in the abdominal cavity. That's why it's so frequently to find it. And when we make the sleeve, it's mandatory to repair because the hiatal hernia is a hole in the diaphragm. And when we make the sleeve, it's like a small tooth. If we don't close that hole in the diaphragm, the sleeve could go inside the chest, could migrate to the chest. If the patient doesn't have previous acid reflux and we don't repair the hiatal hernia, the patient is going to develop. And if the patient have previous acid reflux and we don't repair the hiatal hernia, the acid reflux is going to be worse. That's why the importance of the repairing if we find it in the patients with the sleeve. And like I said, it's so common in patients with obesity because the abdominal pressure increases, and that is one of the causes of the hiatal hernia.
Okay, there was another one. If a patient has severe sleep apnea, is it safe to have surgery?
Yes. We always ask for a report of your previous physician about the apnea, but you could send us the report. but we have the all the additaments that is necessary to patients with apnea. But we always ask to the patient to bring the breathing machine with them because they are going to use it. Or obviously, the patient has to be familiar with the machine because it's important to know how to use it for the patient, because if you are to begin to use it, it's a little difficult. You have to begin use it in the United States to use it here, but you have to bring it, and it's secure, and it's gonna help in the future the bariatric surgery for the apnea.
Okay, they're asking about the rooms in the hospital. So almost all the rooms in the hospital are private. We do have several double beds in rooms, but those are for like if they bring companion, or not companion, but like they come as a buddy surgery, you know, they want to be together, husband and wife, or like friends, or this, so we do have that option, but most of them are private. Can you still get pregnant after gastric sleeve?
Yes, we advise to get pregnant at least 1 year after surgery. Is preferred to wait 2 years because you lose weight. The main losing weight is in the first year, but you're losing weight in the second year. That's why the advice is to wait to the second year after, but it happens, is not a problem. It happens, the nutrition of you and the baby is going to be good, but the best advice is to wait 2 years after surgery.
This is a good one. Victoria is asking, I'm 27 years old, BMI of 46 with PCOS, acid reflux. How do I decide between the new SASI procedure or mini bypass?
Okay. It was, I don't see the question.
So 27 years old, BMI of 46 with acid reflux. Yeah, I should.
The best procedure in that case is the RNY bypass because of the acid reflux. And in the SASI, we preserve the pylorus, like I explained before. We preserve the pylorus, and that increases pressure in the sleeve. We have the connection of the bowel, but is not enough if you have previous acid reflux. If you have previous acid reflux, the best advice is RNY bypass.
Okay, so something they're asking, I'm scheduled for bypass, but I really want sleeve. So what's my situation? So here's the thing. You are not committed to any surgery. You just based on your initial evaluation, right? Your HQ, your initial evaluation, this is the type of surgery you signed up for. You still get a chance to go down there. We still ask you about your health questionnaire. We still have the surgeon talk to you. And if you decide with the surgeon that, hey, I don't want to get bypass and sleeve is good for me, or the other way around, we switch you. It's not like we take you there and we take you to the OR and do the surgery. We will talk to you before that, and you have an option to change. And if there is a price change, whether you have to pay or get refund, we refund you after you come back. If you have to pay, you just pay the difference. So no worries what you're signed up or what you're going to get. Can someone have a mini X with SASI? I think they're saying, can we just do a mini sleeve with SASI? I'm not sure what Alex is asking.
After a mini sleeve, the question
I
is,
think
after
they're
a
asking,
mini
can we
sleeve?
have a mini X with SASI? I think they're saying, you know how you mentioned SASI is a combination of sleeve and bypass, mini
Yes.
bypass? Maybe they meant, can we do a mini sleeve? I don't know. I saw some patients that were asking about mini sleeve anyway.
If the patient, I don't know if it's a question, but if the patient have a mini sleeve previously and is asking for a SASIS, it is possible. If the patient has a combination of mini sleeve with a SASIS, it's not a recommendation because mini sleeve has to have a normally procedure with the sleeve to connect to the bowel and do it as SASIS.
About care credit, and sometimes it does work. The best way is to try it on our online payment portal and see if it works with the credit card you have. Most of the time works. But so which surgery helps the PCOS more? Bypass or sleeve?
Both procedures helps to the PCOS. It is more related about other things that the patient have. For example, BMI and other chronic diseases, the acid reflux. It's a combination of everything to the side, but both helps to the PCOS.
Okay, so I have a good question that when I mentioned the last minute we can change your surgery. So if they are coming for sleep, but the surgeon suggests bypass, that means that they have to stay one extra night. And that's why the flight has to be changed when they go home. So I suggest that you buy insurance for your flight also. Sometimes it's very inexpensive, like $25 or $35. If there is a change in plan, you can always change your flight. Of course, like airlines like Southwest, those are pretty accommodating. They don't charge you to reschedule, but of course, you know, the fare could be different, but you don't get penalized that much. So yeah, I do suggest you buy the insurance. I highly recommend MTI that I offered, and I highly recommend you buy the flight insurance. So this patient is asking, can you repair epigastric hernia during my bariatric surgery?
Okay, yes, we could prepare it during your bariatric surgery. The only thing, it takes a little more time in the operating room, but we could repair it at the same time.
Will issues with your teeth stop you from having surgery?
I don't understand, what?
If they have problem with their teeth, I'm not sure what type of problem it is. Can that be a problem for having the surgery?
And no, there is no problem. We always, I don't know if we use a plaque or something, but there's no problem about the teeth.
If you had previous laparoscopic gallbladder removal, would you still recommend the VSG?
Yes, yes. We don't have any problem about the previous gallbladder removal with any of the bariatric procedures.
Okay, so we almost getting to 2 hour mark. I want to apologize for the delays I had at the beginning, but and then I see still have more questions unanswered. Again, if you don't get your question answered, please reach out to us, call or email your coordinator, and we will be more than happy to answer your question. So I am here to the end of the presentation, and like we said, we have a name of people who we are putting in a drawing and the raffle, and I'm going to pull one name here and see who is the lucky winner. I show it first. Julie Ares. I'm going to look for you and let you talk, Julie, and share with us your story. There you go. You can unmute yourself, Julie, and talk to us.
Hi.
Hello.
How are you? Well, thank you so much for this opportunity. I'm so excited.
So where you live?
I live in Texas.
Okay. Which part?
And I'm Houston, Texas.
Houston.
Yes.
Okay, lovely. So tell us about your story. How old are you?
Well, I am 30 and I've been dealing with overweight since I was 5 years old. And I've always been overweight, but after giving birth, 1 year after the other, I gained more than 120 pounds. So it's been very difficult to deal with that, especially having kiddos. And I've decided to finally make the decision to take a route of surgery because I want to be able to live my best life with my kids.
Best decision, and you're still very young. I congratulate you. You're beginning the surgery with Dr. Osuna, and
Congratulations, Julie.
Thank you so much.
yes, please stay in touch with our coordinator so we can schedule you, and hope to see you down there soon. I'd like to thank Dr. Osuna, of course, and everyone else who joined us. It's a pleasure always to have you guys. Unfortunately, we want to keep under 2 hours, so we couldn't get to the end of the questions. Thank you again. We see you try to make it to Atlanta. I know there are some cities next to Atlanta that you can drive, so please join us there next week, Sunday, 4th of May. And if not, we see you next webinar on last Saturday of the month. Thank you so much again. We hope to have you a great weekend, and this is the best thing you're doing. Take control of your life. Thank you again, and goodbye.